back on a comfortable hospital bed. A doctor in a clean surgical gown asks you to count backward from 10. 10, 9, 8, and the next thing you know, you wake up. The tumor is gone. Your appendix has been removed. Your heart has been repaired. You felt nothing. You remember nothing. Today, surgery is so safe and routine that most people worry more about the hospital bill than the operation itself. But for almost all of human history, someone cutting into your body was one of the most horrifying experiences imaginable. There were no sterile operating rooms, no anesthesia, no painkillers. You were awake for every single second. So how did humanity ever learn to cut open the human body without killing the patient? The answer begins more than 10,000 years ago, with a hole in the skull. Archaeologists have discovered ancient human skulls from Europe, Africa, and South America, with perfectly round holes carefully scraped through the bone. This procedure is called trepanation. Ancient healers believed it could relieve pressure, cure headaches, or even release evil spirits trapped inside the head. The shocking part isn't that they tried it. It's that many patients survived. The edges of these skulls show clear signs of healing, proving the bone grew back after surgery. Without hospitals, without medicine, without modern tools. For thousands of years, surgery remained crude, dangerous, and only used as a desperate last resort. Then came the Middle Ages. Ironically, educated doctors rarely performed surgery themselves. They believed cutting into the body was beneath their profession. Instead, they studied urine, examined the stars, and prescribed rest. If you actually needed a tooth removed, a wound stitched, or a diseased limb amputated, you visited someone very different. Your local barber. The same person trimming your hair also performed surgery. The famous red and white barber pole, still seen today, is actually a reminder of that history. The red symbolized blood. The white represented bandages. Barbers once displayed blood-soaked cloth outside their shops to advertise their surgical skills. But surgery still faced one enormous obstacle: pain. Patients remained fully conscious throughout every operation. The agony was so unbearable that surgeons couldn't afford to work slowly. Speed became their greatest skill. In the early 1800s, Scottish surgeon Robert Liston became famous for amputating a leg in less than 30 seconds. His speed saved lives, but it also caused disasters. During one operation, he accidentally cut off his assistant's fingers while amputating a patient's leg. Both later died from infection. A horrified spectator reportedly suffered a fatal heart attack. It became known as the only operation in history with a 300% mortality rate. Surgery had reached its limit. Then everything changed in 1846. A dentist named William Morton publicly demonstrated ether anesthesia. For the first time, doctors could operate while the patient slept peacefully. The impossible had suddenly become possible. Surgeons no longer needed to race against unbearable pain. They could slow down, study the body, perform far more complex procedures. But another invisible enemy remained: infection. Patients survived the operation, only to die days later. The reason seems unbelievable today. Doctors performed surgery wearing coats covered in dried blood from previous patients. They believed those stained coats were symbols of experience. Then, one physician noticed something no one else had. Ignaz Semmelweis discovered doctors were performing autopsies before delivering babies, without washing their hands. The mothers kept dying. His solution sounded absurd at the time. Wash your hands. Instead of being celebrated, he was ridiculed and eventually forced into an asylum. Years later, scientists proved he had been right all along. Joseph Lister introduced sterile surgical techniques, disinfected instruments, and dramatically reduced infections. Modern surgery was finally born. Looking back, the story becomes extraordinary. For thousands of years, the inside of the human body remained a locked box. Pain prevented exploration. Infection punished every attempt. We first learned to drill through bone. We trusted barbers more than doctors. We discovered how to put the brain to sleep without stopping the heart. And we finally realized that the greatest enemy wasn't the knife. It was the invisible germs on our own hands. Today, every sterile operating room, every surgical mask, every scalpel, And every heartbeat monitor exists because generations before us endured unimaginable suffering, endless trial and error, and countless failures. We conquered pain, we defeated infection, and in doing so, we finally unlocked the human body.